काय नाही ते दिसणार नाही का इकडे म्हणून इकडे
आप इधर बैठो ना.
दिखेगा नहीं ना इधर.
अच्छा तो उधर I know you all are hungry for the knowledge. Yeah, for the first round, judges. Okay, thank you, judges, for the first round. We have shortlisted 6 from them, depending on the marks and the percentile. Okay, thanks to Shraddha. She had done quickly the statistics and calculated some percentile. So unprejudiced, we were able to come to the 6 shortlisted participants for the second round. Before declaring the participant, I would go for the second round rules and regulations. So basically, the second round will be total for the 10 minutes, of which 5 minutes will be given to you to present. Mainly, the presentation should focus on whatever the methodology you have adopted to, whatever the challenges you have identified. Based on that challenges, the solutions and the interpretation is done. Extend that interpretation to the clinical applicability for the homeopathic science. So whatever you have concluded, how it is going to be helpful to the clinician or a homeopathic practice, for which you allotted 20 marks. And the 20 marks, the 10 rest of the marks predominantly will be given to the question and answer session. There will be the 5 judges to the second round. Let me introduce the judges to you. Bhavik sir, Sunita madam, Nikun sir, and Shama madam is on the way. So for Shama madam, and so what we have done, 2 judges we have taken from clinical department, that is psychiatry and medicine, and the 2 we have considered for the non-clinical department, animal laboratory, and man research department. So yes, this is how we continue with it. The previous judges want to declare the
One from each.
yeah, one from the each team. Please come here to declare the shortlisted participants. So the first team was of the Dr. Sonam Sachin sir and Pandit, and they have evaluated. They had evaluated
psychiatry, materia medica, and pediatric materia medica and repertory.
So even though we realized that there was a significant time difference by the team who has evaluated first group and second group. However, while giving the marks and calculating the inter-rated bias, okay, so that has been taken into consideration, those factors, and shortlisted. So they are not in terms of ranking, but in a random order you are declaring.
So the first team we would like to announce is Dr. Padma.
Any guesses from
MM, Dr. Radhika. And third is also from MM, Dr.
The second team was from the judges were Dr. Nikita madam, Dr. Vivek, and Dr. Krishna. I request them to declare announce the shortlisted. Shama ma'am, please come ahead.
So we have shortlisted Dr. Mantri. Dr. Aksha.
First one, please, 5005. We'll start with Padma. So Padma, we have only 5 minutes. Okay, so please take care that it is not essential to tell everything. Okay, points are clear, so you know what to highlight. Highlight only those. Any time for three?
Timer. New mobile.
After 4 minutes, Shraddha, just indicate to her. And after 5 minutes, we will stop. We'll adhere to the time.
Good afternoon, everyone. So basically, let me take you to the journey from complete chaos to the calm. So basically, today I'll be presenting how the role of the management in the temper tantrums in pediatric age group with individualized homeopathic medicine. So basically, everyone we must have encountered the temper tantrum are the most common behavioral early childhood behavioral issues which we see in the children, where it not only let the child be in a distressing situation, but also the parents that both are crying because don't know how to help each other. In this, conventional mode of treatment presents very limited role because there is a counseling which that poor 3-year-old child is unable to understand, and the environmental modification which we cannot do as such. So in this, conventional role of the treatment remains limited, whereas the homeopathic treatment plays important part because it is a holistic and gentle care. So in this study, what it is an uncontrolled experimental study, pre and post design, and 30 sample size with the simple random technique was carried out. So collection tool was used, that the temper tantrum checklist with 22 questionnaire where 0 to 5 this ranking has been given according to the intensity, frequency and duration of the temper tantrum. So mild, moderate and severe tantrums were considered, where all the 30 cases were from moderate temper tantrum. After that, the inclusion and exclusion, all the children from between the age of 1 to 12 years were included, both the sexes, excluded only those with the known case of the psychiatric illnesses like ADHD, ODD, that kind. After this, after first before starting the treatment, the temper tantrum checklist was applied. The score was noted down. According to the mental and physical symptoms, the totality was formed and CR was released. After 6 months of treatment with the RREF form, qualitative analysis of the follow-up was done, and again the checklist was applied and the score was calculated. So this was the methodology which was carried out. In this, only the homeopathic individualized medicine was introduced, and in some cases, where in the 16 cases, there was need of intercurrent remedy according to the understanding the mental and the physical level, how the symptoms were evolved during the course of the treatment. After that, in this, no any counseling or psychoanalysis, anything was done. Only the homeopathic medicine was introduced. So if we see in the observation and result, Calcarea phosphoricum, Lycopodium, tuberculinum are the most common remedies in the